Hi everyone, it's truly Cray. Hope everyone's doing well. I'm here today to talk to you about Brook's birthmarks. Um, just to give you a little background, Brook is up, but she's in Bailey's crib. Bailey's up, but she's in Beau's crib. And Beau's sleeping, she's in Brook's crib. It's in alphabetical order. Bailey, Beau, and Brook, but sometimes I like to give them a change of scenery, so Beau ended up falling asleep in Brook's bed. Anyway, I wanted to talk to you about Brook's birthmarks. Mainly, she was born with one hemangioma. It's like a benign tumor, but like a strawberry, what people call them, on her right shoulder. And she ended up forming a hemangioma on the left side of her scalp, small. She was also born with some skin tags, extra skin, and a little extra cartilage on this area right here when she was born. If you go over to my blog, I have like the medical terms for everything. I just didn't want to start fumbling and mispronouncing everything, so I'm saying everything here in layman's terms. But I guess as a parent, you wonder some of the traits that get passed down. Is my child gonna have my bad eyes? Is my child gonna have my gap tooth? Or for me it was gaps, but for me it was also are they gonna have eczema? Cannon does have eczema. These girls have very, very mild eczema, but Brook was the only one who had hemangiomas, which is what this is right here. It's what this is right here. I actually was born with 11 of them. Some of the bigger ones didn't disappear. They're supposed to disappear, from anywhere from 3 years old to 5 years old, grow to their maximum, I guess, potential up to a year. But, when I was young, my parents decided to leave them. They weren't hurting anything. They weren't anywhere on our face or anywhere obvious. Same thing with Brook. Aside from the skin tags on her face, which, removing them was basically cosmetic, we weren't going to remove the one on her shoulder, even though, you have a lot more mobility and movement here. And the one on her scalp is very similar to my sister Monique. She has a few, but she also has one on her scalp. So, I even have one under my arm. But, all my life, hemangiomas never caused any pain. I'll bring Brook over in a second and, show you everybody. But, they were painless. They looked a little odd, I'll say, but they were painless. One day, how you pick up a child by like one arm. You're not like this, but you pick them up, and it looked like she like flinched. And I'm like, is it her shoulder? I had, my husband, do all of this, and it wasn't that. And then I noticed on the birthmark, it looked like this, that there was a darkening center that wasn't there. So I pressed on it, and it kind of was like bruised, and that's when like she started crying. So I called the doctor, pediatrician, and long story short, they were convincing me over the phone that it wasn't the hemangioma, it was her shoulder, and to give her Tylenol, she'll be fine. Well, I didn't take that for an answer. We were going to be traveling soon. I said, no, we have to come in. I know it's the hemangioma. And lo and behold, when we went there, they determined it was the birthmark that was causing her the pain. They said that there are several types of hemangiomas, which I was unaware of. And some of them start to what they call involute. There are non-involuting congenital hemangiomas. There are partially involuting congenital hemangiomas, and there are rapidly involuting hemangiomas. This one appears to be somewhere in between rapid and partial. So what happened was the blood vessels started to collapse and dry up, basically, and it was starting to dry up from the inside out and cause what they would compare it to as like a skinned knee, which for, you know, a 6-month-old, 7-month-old hurts. You know, it dictated how we were feeding her because we didn't want to rub up against her birthmark. It determined, you know, how we laid her on bed. She had started to you know, started to look like this a little bit, and just to or like this, like to try to like get away from the pain. And you know, I was like concerned that she was gonna need some physical therapy to like straighten out her head. Who is that? Bailey? Bailey? So, but thank God, it had gotten to its worst pain a few weeks ago, and I kind of freaked out. You know, the pediatrician, or one of the pediatricians, said, you know, put some Neosporin on it, and got us a expedited appointment to CHOP, you know, Children's Hospital of Philadelphia's dermatology. We went to dermatology. They said not to put Neosporin on it because Neosporin could get into their bloodstream and they can get an allergy to it. So we stopped that. You know, I had gotten there was a Gold Bond like antibiotic that had lidocaine in it, thinking that the lidocaine would help with the pain, but then the pediatrician also said that the lidocaine isn't good per se. Plus, it wasn't really helping a whole lot because the lidocaine could get. Let me get Billy. I'm just gonna hold Bailey for a second. So the lidocaine wasn't good because that could get in their bloodstream and can cause like a heart murmur. So my concern was like, let's get this stop causing Brook pain. The dermatologist then gave us an expedited appointment with plastic surgery. You know, plastic surgery, we had an appointment with already to have them look at her skin tags, but they normally don't do surgery on babies under a year. But when we went to plastic surgery, they determined that her birthmark needed to get removed sooner than later to stop causing the pain. They also decided while she was under, just to remove the skin tags, you know, fix her little ear, and to also remove the hemangioma that was on her scalp. So everything's getting done at once. You know, I know that the skin tags were cosmetic, and you know, just like any concerned parent, you don't. Well, I didn't want to do anything, you know, in vain, you know, for looks. Like it really wasn't about that. It was just about making sure, you know, she wasn't in pain anymore. So, you know, the doctor reassured us, like, you know, it's not that, like, this needs to happen. If it was his child, he'd get it done. You know, he said he was a conservative surgeon, and you know, they're gonna get in and get out. You know, it should be shorter than 2 hours, and kind of gave us a long list of do's and don'ts, you know, as far as like eating and drinking prior to her surgery. So we have a date. That date is this week, and I'm looking forward to being on the other side of the surgery. I'm excited about that, and curious to see how everything's going to turn out. There's not going to be any bandages, maybe a little coverage here. You know, this was like in a bad place, from her car seat to the high chair to putting her arm in and out of to putting her arm in and out of clothes, right? So anyway, you know, everybody, you know, say a prayer, please. I'm thinking that the night before, saying my prayers won't be too tough as far as feeding. You know, she can't get any formula past 6 hours to her appointment. She can't get breast milk, you know, 3 hours to her appointment. So thank God I have a stash of breast milk that I'll be able to give her. And then she can have clear liquids, apple juice, water, clear grape juice up to 2 hours. So let me get Brooke. Let me get your sister, right? The youngest. This is Bailey. Okay? We're gonna get the lady of the hour that we're talking about, right? Yeah. Here's Brooke. You say hi, Brooke. Hi, Brooke. She just woke up. So this is Brooke. These are the skin tags, which I think they're just gonna tie off. And this right here, this is that area, begins with a T, that they're just gonna shave down. Now, even though, and this is the small hemangioma that's on her scalp, this one isn't causing her any pain, but they also don't want to chance it and leave it and then it cause her some pain. So that's why they're just going to remove everything while they have her under. And then these are those Cat and Jack rompers that zip up from the bottom, which is good when you're changing them from the bath. But it's bad when you're trying to show the shoulder. Right? And just because it's plastic surgery doesn't mean she won't have a scar. You know, some of that's genetics and timing. Ooh. So that's the birthmark. You know, it always looked raised and kind of red, but now, if you can see, it's dark and kind of scabbing and drying up. Ooh. So, you know, keep us in your prayers. I wanted to film this and put it up, and then we'll do a follow-up video, right? You saw in the other video, Brooke was Cannon's favorite because of her dots, and he's so sweet. He's all ready for her birthmarks to be removed and for her not to be in any pain anymore. So hi, there's my baby. You know, I mean, just positive thoughts, and she's gonna be reunited with her sisters. And we're going to be on the other side of healing. It should be a fairly routine and quick surgery. We won't know the time of her appointment, but the youngest person goes first. So that should definitely be Brooke. They open at 6:30, so I'm hoping that... Yes! Right? That we're there nice and early. Right? That it's all timed right. And we'll get there and it'll be done hopefully by the time most people get up. So, you want to see if your sister's awake? You want to see if Bo's up? Yes? Okay. Say bye. One last look. One last look at her skin tags. Yes? Julie? Hey! And here's Bo. You say hi, Bo? Bo. She likes to stand, remember? So I'm going to finish it with Bo. We will definitely have an updated video on Brook's birthmarks. There's a post up on the blog with a little bit more detail and medical terminology on the blog. And all we ask is that you rate, comment, and subscribe. I am going to be doing an FAQ video, so please continue to leave your comments and questions down below, and we'll see you soon. Right? You say bye, Bo? You say bye? You say bye. You say bye-bye. You said bye? They said bye. All right. Talk to you later. Bye.